Good day and welcome. We are so happy that we can start this debate. First of all, I want to inform you that this debate is recorded. So if you take part, you consent in being part of that recording. And if you don't like that, you are more than free to leave, but we will record it to be able to share it with more people later. Then practical, this debate is in fact, the full debate is supported by speech-to-text, live speech-to-text in English. You just click the CC button at the bottom of the screen, and then you can activate the captioning in English. But you can also use text on tap to get a translated captioning in Dutch, French, German, Polish, and Spanish. And to access that, there's a link in the chat that you can see where you can just click and then open text on tap to get the translations if you want to be happy with that. And that was also a special request from the MEP. So without further ado, maybe one more thing. If you have questions, we will in fact gather all the questions. And at the end, during the debate, we will select the most relevant questions, the questions most posed to the different panelists, and just put them in the Q&A. So not in the chat, but in the questions and answer Q&A button. You can also see at the bottom, and we will carefully select them. So without further ado, I am very happy to kick off this year's debate and give the floor to our host MEP, Jarosław Duda from Poland. Mr. Duda, MEP Duda, you have the floor.
Szanowni Państwo, witam serdecznie publiczność i wszystkich mówców, którzy zechcieli wziąć udział w dzisiejszej debacie zorganizowanej z okazji Światowego Dnia Słuchu. Nazywam się Jarosław Duda, jestem posłem do Parlamentu Europejskiego z Polski. Priorytetami mojej pracy parlamentarnej są kwestie dotyczące praw osób z niepełnosprawnościami i osób starszych. Bardzo dziękuję zarówno Europejskiej Federacji Osób Niedosłyszących, jak i Europejskiemu Stowarzyszeniu Protetyków Słuchu za inicjatywę zorganizowania dzisiejszej debaty, ogromne zaangażowanie i doskonałą współpracę. Szanowni Państwo, częściowa lub całkowita utrata słuchu może dotknąć osób w każdym wieku. Szacuje się, że problem ten dotyczy ponad 57 milionów Europejczyków. Dodatkowo, biorąc pod uwagę zmiany demograficzne, spodziewamy się, że ta liczba będzie wzrastać. Co trzecia osoba powyżej 65 roku życia ma dziś problem ze słuchem. Mamy więc do czynienia z ogromną skalą problemów, z którymi osoby głuche i niedosłyszące borykają się na co dzień. Światowa Organizacja Zdrowia w 2021 roku zalecała wdrożenie systematycznych badań przesiewowych słuchu oraz szybki dostęp do terapii i urządzeń wspierających słuch. Jednakże wciąż jesteśmy daleko w tyle, jeśli chodzi o wdrożenie tych zaleceń. Nieleczona utrata słuchu kosztuje Europę 213 miliardów euro rocznie, a to tylko wymiar ekonomiczny. Dramatyczne są przede wszystkim skutki społeczne, takie jak ograniczony dostęp do edukacji, zatrudnienia, dóbr kultury, aktywności obywatelskiej, a także niezależnego, satysfakcjonującego życia. Aby poprawić sytuację osób głuchych i niedosłyszących, konieczne jest podjęcie działań w kilku obszarach. Po pierwsze, potrzebne są kampanie informacyjne i inne wydarzenia podnoszące świadomość obywateli na temat problemów ze słuchem, ich profilaktyki i leczenia, a także sytuacji osób głuchych i niedosłyszących. Konieczne jest uświadomienie obywatelom, że każdy z nas może częściowo lub całkowicie stracić słuch, a zatem jest to ważna sprawa, która dotyczy nas wszystkich. Po drugie, potrzebne są działania na rzecz zmiany błędnych wyobrażeń i stygmatyzującego podejścia do osób niesłyszących. To także wiąże się z zapewnieniem rzetelnej informacji i promocji postaw i rozwiązań wolnych od dyskryminacji i uprzedzeń. Dostępność informacji, komunikatów usług dla wszystkich obywateli, także dotkniętych różnymi formami niepełnosprawności, musi stać się normą. Chcemy żyć w społeczeństwie włączającym, sprawiedliwym, solidarnym, przyjaznym dla obywateli, a zatem musimy uwzględnić potrzeby społeczeństwa, w tym potrzeby osób z różnymi typami niepełnosprawności, takimi jak osoby starsze, rodziny z dziećmi i tym podobne. I wreszcie po trzecie, potrzebne jest zwiększenie dostępności badań, terapii i urządzeń wspierających słuch, a także upowszechnienie profilaktyki ubytku słuchu. To konieczne, aby ograniczyć ogromne koszty ekonomiczne i społeczne powodowane przez zaniedbanie potrzeb osób zagrożonych problemami ze słuchu. Drodzy Państwo, tyle tytułem wstępu. Pozwólcie, że teraz przedstawię dzisiejszych mówców. Jako pierwsza pani dr Shelly Chadha, kierowniczka do spraw ochrony słuchu i uszu w Światowej Organizacji Zdrowia, przedstawi główny temat Światowego Dnia Słuchu 2024. Pani Lidia reprezentująca Europejską Federację Osób Niedosłyszących, omówi znaczenie zmiany sposobu postrzegania osób głuchych i niedosłyszących. Pan Mark Laureyns, reprezentujący europejskich protetyków słuchu, omówi mity i realia dotyczące ubytku i pielęgnacji słuchu. Pan Stefan Launer, reprezentujący producentów aparatów słuchowych, opowie o nowoczesnych rozwiązaniach technologicznych. Pani dr Emma Smith, specjalistka do spraw technologii wspomagających w Biurze Regionalnym WHO na Europę, przedstawi argumenty, dlaczego należy zapewnić włączające systemy opieki zdrowotnej w Europie. Przekazuję zatem głos pani dr Shelly Chadha i życzę Państwu owocnej debaty. Dziękuję bardzo.
So thank you so much, MEP Duda, for this great introduction. Now we really have the honor to introduce the driving force behind World Hearing Day. Dr. Shelly Chadha, she is the technical lead for ear and hearing care at the World Health Organization in Geneva. She will introduce the World Hearing Day 2024 main theme. Changing mindsets is crucial for improving access and reducing the cost of unaddressed hearing loss. Dr. Chadha, the floor is yours.
Good afternoon and greetings from the World Health Organization. The theme for World Hearing Day 2024 is about changing mindsets and how changing mindsets is really essential to making ear and hearing care a reality for all. To start with, I'd like to share with you a real-life story that was told to me by a colleague back from India. And this story is about a young man. Let's call him Amit for the sake of calling him something. So Amit is a young man in his, I think, early 30s, living in a big town of India. And the story starts about 7-8 years back when Amit started working at a call center at a BPO, where he had to spend most of his time, all of his working time, talking to clients and customers over headphones and earphones. At leisure, during his leisure hours also, Amit enjoyed really listening to music over his headphones and playing video games occasionally. After a few years of working there, Amit started noticing that he was having this ringing sound in both of his ears. And he just ignored it at first and didn't bother. But when many months had passed and it was still persisting, even increasing, so he went to his family doctor, whom he had been going to since he was a child, and told him about it. And his family doctor suggested some lifestyle changes to reduce his stress levels and all, which of course can contribute to tinnitus. Good advice all around, but it didn't really help his tinnitus. And after a couple of years, when Amit started noticing that he was also having difficulty in understanding what his clients were saying and he needed to ask them to repeat, he decided to visit an ENT in the same town. So when he went to the ENT, he had a hearing test, and it was evident that what he had was hearing loss and hearing loss due to noise damage in both his ears. He was advised to use hearing aids. Amit was completely stunned and shocked. Hearing loss? Isn't that something that happens only to old people? And hearing aids? I mean, how could he go wear hearing aids and go to work? That would be impossible for him. And so he went back and kept doing what he had been doing. Another couple of years passed, and his problems just grew worse and worse, and he had no option now but to come back, get fitted with hearing aids. And then, of course, his hearing became better after a few months of using it. He felt definitely better. He was able to live with this tinnitus also better. But what Amit's story or his experience points us to is really the importance of changing mindsets. Because let's look at the barriers that Amit has faced in his hearing journey. So firstly, the barrier of his own misperceptions and stigma, misperceptions and ignorance about the impact of sound on ears, and that tinnitus could be an indication that needs to be explored for hearing loss, and even the fact that, well, hearing loss could actually happen at any age. Also, the lack of correct knowledge among the healthcare provider, the family doctor that Amit went to. He did not properly guide him to take a hearing test and to seek the care that that Amit needed. And that was due to his own lack of knowledge and capacity. And lastly, the societal stigma that influenced Amit's decision to delay accepting care and start taking really any precautions for a long time. The story and these barriers are not exclusive to Amit. They are significant contributors to the fact that less than 20% of those who could benefit from hearing care actually use these services. The fact is that in the field of hearing care, we have all the solutions. We have all the solutions to prevent, to identify, and to address hearing loss. Any level of hearing loss, at any stage of life, in any setting, can be addressed. And yet, what we see is that the prevalence of hearing loss and unaddressed hearing loss continues to rise steadily. Now, the framework for addressing this growing need has been provided by WHO in the World Report on Hearing that lays out the concept, the strategy of integrated people-centered ear and hearing care. What WHO has also done is provided a whole set of technical resources for how to assess prevalence and causes of hearing loss, how to plan for hearing care, how to train healthcare providers, how to screen, how to prevent hearing loss, how to check hearing yourself, what kind of hearing aids to provide, and what rehabilitation services are required, and how can hearing aids be provided in low and middle income settings. But what we also need, in addition to all the health system interventions that are laid out here, is really concrete action to address the misperceptions that are prevalent in society, to improve knowledge, and to mitigate stigma. The barriers that Amit faced, we need to turn these around through informing, through capacitating, and through including. Informing people about healthy ear care practices, about hearing protection, about the importance and possibility for timely care seeking. And for this, WHO makes available a number of resources about healthy ear care, resources also to bust the myths and misperceptions about hearing loss and address stigma. But also, we need to build capacity amongst primary and secondary level healthcare providers through systematic training and through availability of equipment to them. WHO provides also resources for these in the form of a fact sheet which lays out, gives in brief the information. Why should all healthcare providers be interested in this, and what can they do about it? Also, a training manual that provides guidance on how healthcare providers, non-specialists, non-ear and hearing care specialists, primary level providers, family doctors can be trained. Also, tools and resources for fostering inclusion through becoming hearing loss friendly, and also through highlighting the stories of people with lived experience of hearing loss. So addressing stigma. On this World Hearing Day, WHO calls for strong action from governments, from civil society partners, from developmental agencies to inform, to capacitate, and to include. Inform the general population, capacitate, build capacity amongst healthcare providers, and to ensure inclusion of people with hearing loss so that ear and hearing care can become a reality for all. Thank you.
Thank you, Dr. Shelly Chadha, for this wonderful overview of this, what is happening. The next speaker is Lidia Best. She is the president of EFHOH, the European Federation of Hard of Hearing People. She's also a member of the steering committee of the WHO World Hearing Forum, and she was nominated since doing this since November last year. And she's also driving as a co-chair the work stream for Make Listening Safe at WHO. Lidia is an experienced cochlear implant user, so she knows all about what it is to have a hearing disability and how to compensate for that. And you will see that she's doing perfectly during her talk and during the discussions. She will explain the user's point of view and the reasons why it's so urgent to change mindsets. Since you can't see that a person has hearing problems, the impact of hearing loss is unknown. It's essential that we make our world inclusive for hard of hearing people and in all European countries. Access to quality ear and hearing care has to be guaranteed. Lidia, you have the floor.
My name is Lidia Best, and I am the president of the European Federation of Hard of Hearing People. This is a great pleasure to participate and speak at the European Parliament debate on occasion of the World Hearing Day 2024. Today, we will be tackling the theme of this year's day, changing the mindsets. My tasks, given by the chair of the debate, is to discuss why we need to change mindsets. Let's look at it and let's tackle it. First of all, society attitudes towards hearing loss. What are they, and what we can do about it? What we see is everyday ableism and negative and misleading attitudes, which contributes to all around hearing loss. One of those are what we see here, which is that hearing aids can be ugly, but ours are visible. An advert from a service provider. And I have to say, I haven't seen this lately, so I think it's been taken down due to the backlash, of course. The second photo is a photo of an older person, clearly, with what looks like a hearing aid, but it's not a hearing aid. It's a personal amplifier, a very cheap replica. It does not do justice to the hearing aids we currently have. And those negative attitudes are holding back many people from achieving their full potential because they simply will not seek help because of the way how they are perceived. So as we have discussed now, this stigma is often linked to hearing aids. To age, only old people get hearing aids, right? But also it's linked to perceived intelligence, because we are seen as someone who may not have been in a very high level of literacy, or the way we speak, or many definitions. What we often get, especially how often I've been hearing that kind of question, it's when you mishear something, misunderstood, or ask for repeat, quite immediate response is, are you deaf or what? And that kind of question puts you back. You don't even want to own up to it because it's a loaded question, negative question. Another bad question which is linked to ableism, perceiving what we can and cannot do just because we cannot hear very well is, but how can you do this? And is often both linked to employment, but also in education. If you are trying to have a chosen profession, which is something what is perceived by the society and educator, but you can't do. For example, you cannot be a doctor because you just can't hear very well people's hearts, for example. Well, let me tell you, actually, yes, we can. Those of us who choose to go down that path can use assistive devices, and the technology has gone very far indeed to allow us to listen to your hearts and look after your hearts safely. So what we see is a very strong correlation between the attitudes the society holds and the lack of confidence from our perspective in requesting support, because we are seen as someone unable to function the way everybody else perceives. And we are a diverse group. We are not all the same. You've met one hard of hearing person, you haven't met them all. So I'm sharing today how diverse we are in the age, in the different talents we represent, and the wealth of knowledge we bring. One photograph is a group photograph from London during our AGM in 2017. And the other photograph is very recent from last year, European Day of Persons with Disabilities in Brussels. Our diversity is our strength, but it also benefits the society. Well, you have seen some labels. That is another perception and different mindset to tackle. They are all different labels. We are using it sometimes because they are useful and helpful for us. But for others, for society, they might be sometimes confusing. We are deaf, hard of hearing, deafened, partially deaf, cochlear implant users, and or deafblind. all of those labels reflect different way of how we communicate, how we participate in the society, what kind of methods we are using, and what type of loss we have. For the deafblind people, but dual loss, vision and hearing. Yes, your head must be spinning right now. So how we communicate? We communicate using hearing aids and cochlear implants in terms of the medical devices. Then we are also using hearing loops and assistive listening system for those who can use those systems and can actually help themselves enhance their way of hearing. And this is why we need the public accessibility, such as hearing loops. We also use assistive devices and apps, such as live captioning on our smartphones and other devices we might need, as I mentioned earlier, for doctors. We are excellent lip readers. Many of us are actually even expert forensic lip readers. We are also using speech-to-text, which is the captioning, which today we are also using for our debate. And that is very much universal public access for anyone. How many people actually benefit from using speech-to-text? We also, for those groups which are deaf or from the cultural background of deafness and who need sign language as the first preferred sign language, also use sign language as well. And then we've got those visual clues. Yet, the policies and system put in place currently do not reflect our diversity. And that is a really great shame. So let's investigate further. Well, one of the things we need to look at is how the policymakers decide who is disabled, who is not, who can have a hearing aids, and who cannot, especially, or cochlear implants, especially in terms of national health reimbursements. Ladies and gentlemen, we are not walking audiograms. Audiogram is just a part of the story, part of assessment, but it should not be looked at as the main assessment. So I'm sharing today a wonderful sketch from our member in Poland, Maria Skoczyńska, who is documenting the life of deaf, hard of hearing, deafened person from perspective of hard of hearing person. And the wonderful sketch is all about something what my colleagues, my friends, anybody with hearing loss knows very well. Sitting in an audiometric cabin or audiogram booth and actually trying to decipher if the sounds I'm hearing coming from the headphones are the sounds truly coming from the headphones, or, as in my case and many others, my tinnitus is playing tricks on me, and I'm not so sure when I'm hearing tinnitus playing in my head or the actual sound from the played by audiologist. And for this reason, disability assessments often do not reflect real life of people with hearing loss. We need to improve those assessments to bring into real life. For another reason here to mention is that implants such as cochlear implants, hearing aids do not restore the hearing. Of course we don't. It's not going to come back in the same way we used to have. But hearing aids and cochlear implants do provide access to communication and reduce isolation and have many, many more benefits which we know about. So please don't dismiss the need for hearing aids or cochlear implants. Having said that, just because we have a hearing aids and cochlear implants, we are not fixed yet. No, it's not possible at this time. But it does not reduce the need for us to have visible, accommodation, at work, in employment, or in public space. So let's look at the employment. Here is just simple stock picture of people working at this table. There could be people with hearing loss here. Yet, what we are seeing often, in employment especially, is that employers see our hearing devices, cochlear implants, they are seeing our hearing loss. They don't see us. Therefore, see me, not my hearing loss. This is what we need to change now on the perceptions from the society and employers. And I'm sharing here a quote from the report which was published in 2018 called European Federation of Hard of Hearing People Late Deafening Report. Potential employers cannot look beyond your hearing devices. You are labeled as deaf and cannot hear a thing. The potential employer does not look at your talents and what you can do. What a great shame to look in such a way without looking beyond just the device. Here comes Nuria again to rescue, presenting how diverse hard of hearing people are and how capable of multitasking. But actually, the spy companies, they could do very well with us, our help. And for one of our reasons is also one of those reasons we are working directly with the European Commission Disability Platform, which is a platform when member state representatives, European Commission representatives, and civil society representatives meet, discuss, and work together on joint projects. One of those projects is Disability Employment Package, which is to improve labor market outcomes for persons with disabilities. And that report, all the guidelines, all the guidances are there available to everyone to check, for employers, for employees, and in general for everyone. Because, ladies and gentlemen, there is a big issue when many people with hearing loss will not disclose their hearing loss, the issues with hearing, on the application form for employment, simply because they are pretty sure that they will be overlooked for their position if they disclose their disability. So, once again, see me, not my hearing loss. But there is one more thing to tackle, policymakers. Right now, we have on our website a report launched in 2022 called Hearing Aid Reimbursement in Europe. And from that reimbursement, we have seen in some member states, the reimbursement levels of 25% to 100% for the cost of hearing aid. But we also have seen long waiting list and lack of choice in the reimbursement process. Often, those reimbursement policies do not match the real need. And that brings me back again to the audiogram. Because sometimes it's just arbitrary decision that at this level of hearing loss you can get reimbursement, but that does not reflect the reality of people and their needs of support. In many countries, however, children are supported very well, and this is important. However, adults, especially those of a working age, senior citizens, are not. And that group, both groups need to get support and need to be taken seriously. We cannot afford people sitting at home, unable to work or working in the employment which is below their abilities, simply because we don't want to spend money. And it's important because as statistics say, and I'm sure you have heard it before, 466 million of people with disabling hearing loss worldwide. And that's the statistic from the World Health Organization. And one of the main impacts of hearing loss is on the individual's ability to communicate with others. So can we really afford money pinching? 178 billion euros are lost every year by all different surveys, statistics thrown across in different years, just in Europe. And the money are lost due to lack of investment in support. And why is that? Because many policymakers, especially those with 25% of reimbursement for hearing aids, are just using false economy. However, I'm having a last word for ourselves, for myself, and everyone who has a hearing loss, especially for the advocates in different countries. We have to start with ourselves. We have to start speaking out. We have to start pushing. And the words of, if you don't demand what you wish for yourself, you won't get it, are coming from a senior figure in the disability movement. Judith Heman died last year. She is widely regarded as the mother of the disability movement, hailing all the way from the United States, and a wheelchair user. And she was always saying the same thing. We have to stand up for ourselves because nobody else will stand up for us. We have to create allies and we have to work together. We have to start demanding what is needed because tomorrow somebody else will need it. Thank you for your attention.
Time. I have the honor to introduce myself, which is slightly strange. But my name is Mark Laureyns. I represent the AEA, the European Association of Hearing Aid Professionals, and we will shed a light on myths and reality on hearing loss and hearing care. As you may have heard, since hearing loss is an invisible disability, since users request very discrete, invisible solutions, not the ones you have seen from Lidia just now, the consequences are that hearing loss isn't always taken very serious, that also audiologists and hearing care professionals remain an unknown and invisible profession. And typically 15, 16-year-old students, when they need to select their profession, they don't have a clue what audiology is. So we hope we can go into this. So I'm happy to launch this presentation. Thank you. Hello. I'm very happy to tell you more about myths and reality on hearing loss and hearing care. Now, to look at this, we used the new Copilot, the AI-powered productivity tool developed by Microsoft, because we hope it will reflect the common view of the public. So when you ask Copilot, what are the myths about hearing loss? Then you get the answer, certainly. Let's debunk some common myths about hearing loss. One of them is hearing loss is just a part of getting older, so it can't be that important, or it's normal for people's age. Secondly, my hearing is fine. It's just that everybody's mumbling, so it's the others which are the problem, not me. And then I'll wait to get my hearing tested until I really notice the problem. But the issue is with hearing loss, it slowly declines, so you don't really experience it, and that is why a lot of people wait too long. So remember that hearing health is an essential part of our overall health, and addressing hearing loss proactively can lead to better quality of life. So far, Copilot. Now, if you look at the team for World Hearing Day today, we're looking at myths and realities. So one of the myths we are hearing is that hearing loss is seen as a disability which is not important to manage. Is this so or not? The stigma related to hearing loss is high and it's increasing. Hearing aid users are not respected and perceived as unintelligent. That's another myth. Hearing loss is an invisible disability and audiologists are invisible, unknown professionals. Is that so or not? So we'll dig into that. So hearing loss is seen as a disability which is not important to manage. If you look at the research, we look at a study conducted by Carleton, and then you see that on a survey of 1,200 adults between the age of 50 and 80 years, they asked what is the most important health condition to manage. And there you see that hearing loss ranks very low, just before asthma and just after arthritis. So this looks like an issue for the general group at that moment. It's a fairly large group when you look into this. If you ask the same question to people who perceive to have normal hearing and who are not using hearing aids, the ranking is even lower. It's only 1% that states that hearing loss is important to manage. So it's kind of unclear. If you don't experience a problem, you don't see it as an issue. And then if you ask this to the group who does perceive a hearing loss and are using hearing aids, then you see that the ranking increases. They see that hearing loss is much more important to manage. And that's of course clear because those people know exactly what it is and they know also what managing hearing loss can do. So far the public view, what we are looking at. But what about health providers? And here we asked first line health providers, so primary healthcare. And then you see, as people that experience normal hearing, they also rank the management of hearing loss very, very low. Also the lowest condition after asthma, after vision loss, after many other aspects. So I think you see that there's something to work on, right? So you see it's very low as a fairly low importance to manage. Now to handle that, we set up a campaign in Belgium. It's the National Health Institute that has been doing this, the health insurance system. And they say that hearing loss is never normal. That's a huge campaign towards general practitioners. They say this because many GPs state that if people come and they're in their 50s, 60s, 70s, and people say, I have a problem with my hearing, say, well, how old are you? And if you say more than 60, they typically say it's normal for your age. It's never normal. So they need to detect, discuss, and refer when there's an issue. We also pointed out in that campaign what is found in the World Report on Hearing on what are the consequences of untreated hearing loss, and it's a lot, right? Of course, you have communication issues, but that has impact on health. You have social isolation, more people with loneliness. You have an issue with employment and you get burnout. There's a higher prevalence of depression, lower quality of life, lower psychosocial and cognitive health, and the risk of dementia, which is provided. So I think it's very important to handle hearing loss, to treat it correctly, and to be sure that you prevent all these consequences. So that's point one. So unfortunately, it is correct that hearing loss by the general public and by primary healthcare professionals is not seen as something which has a high priority to manage, which is a shame. Now, what about the stigma related to hearing loss? Is it high and is it increasing? If you ask Copilot, typically they say that the stigma surrounding hearing loss remains a significant challenge. Stigma leads to delayed treatment, which is unfortunate because people want to hide it, so they will delay the treatment. There are social and cultural associations related to this, which is an issue. And there's a lot of misunderstandings and stereotypes. So people with hearing loss being considered of being old, cognitively diminished, and being poor communication partners. That is why we need to do something about it. We need to raise awareness, we need to promote education, we need to normalize hearing aid use, and we need to combat stigma. So Copilot states that, remember, hearing loss is not just an inconvenience. It impacts overall well-being. Let's work together to reduce stigma and create a more inclusive environment for everyone affected by hearing impairment. So far, Copilot is doing a very good job, and I think it's very good requests. So let's look at the research.
There's many publications on this topic, so I will just highlight one of them, looking at what is the stigma related to hearing loss and is it increasing? It's the stigma of diseases, unequal burden, uneven decline by Best et al. The first aspect of stigma is what they call judgment by the general public. So they think that people are believed to be responsible for their condition. And if you look at the trend over the years, because they already start in the 80s up till now, then you see that typically behavioral disabilities like non-normative behaviors, addictions, eating disorders, and other mental illnesses, they are rated quite high on judgment. This is followed by infectious health conditions like sexually transmitted infections, other infectious diseases, hepatitis, influenza. This rates lower on judgment, so people are less blamed to have this condition and to be on their own. Interestingly, chronic, like cancer, autoimmune, genetic, but also visual and auditory impairment, ranks very low on this condition. You see that the judgment is fairly low, so people say that they don't blame people with hearing loss for having this issue. And you also see a decline over the years. So where do we position hearing loss? And then if you look at this, so we have the overall scores, and you see that in fact hearing loss scores very low. Going into the upper level for behavioral issues, you see that hearing loss is only positioned here. Another aspect of stigma is disgust, and that is more linked to the public linking this to the contagion. So they want to avoid the mechanisms and they want to stay away from it. And not surprisingly, what ranks then very high is infectious. It's kind of logical because if it's infectious, the risk that you will it will be contagious is of course higher. Behavior ranks lower, and also here chronic, including hearing loss, also is much lower than the others, but you see there's also an interesting decline over the years. So where is hearing loss on this position? As you will see, hearing loss is really at the bottom. So people are not disgusted because people have a hearing loss. That reflex isn't happening at all. So that looks good. So we see that judgment and disgust is declining. And we also see that hearing loss typically ranks middle low or very low depending on the aspect of stigma. So seems to be there's no problem if you look at the overall field of stigma from different diseases. So that looks like this is not correct, right? That stigma is high and it's increasing. But the issue is there's a lot of self-stigma for hard of hearing people. So let's dig into that. That's another study, a publication by Dana David that was published fairly recently. And there you see that they talk about multiple aspects of self-stigma and also stereotypes which are existing. So the typical stereotypes are that people with hearing loss are old, stupid, and crippled. And that's what you see here, right? The typical stereotypes on the cognitive attributes. The emotional aspects is that it's followed by shame, and people pity people with hearing loss. That's the myth and the stereotype. And the consequences are that people with hearing loss will conceal that they have a hearing problem or will withdraw from the society, leading to social isolation. And that's what they found in this study, based on an in-depth interview from older people with age-related hearing loss. You see all these aspects coming back here. Unfortunately, when you look at what is the impact of hearing care and hearing devices, they seem to think that hearing devices even makes this worse. So yeah, unfortunately, that is confirmed that the self-stigma of hard of hearing people is high. And that's a shame, and that's something to work on. Now, are hearing aid users not respected and perceived as unintelligent, as they seem to think? Let's ask to a pilot. Well, they say that hearing aid users should be treated with respect and empathy, just like anyone else. Unfortunately, there are instances where people may hold misconceptions or stereotypes about individuals who use hearing aids. So that's unfair and inaccurate. So points to consider is there's a diversity of abilities. Many people with using hearing aids have huge, great abilities. People with hearing loss and hearing aids have challenges and they need to adapt. So you see that they're doing a lot of effort, and that needs intelligence and good way of working. And we also need to work on awareness and education. both about hearing loss and assistive devices, to break down those stereotypes. Advocacy is important, and the best placed are hearing aid users and organizations really play a crucial role in challenging these stereotypes. So let's celebrate the uniqueness of each individual. Let's recognize their values beyond the typical characteristics or the assistive devices they may use. They are worthwhile and they should live the life to the full. What about studies? And typical studies are typically called the hearing aid effect, right? What do people think about people with hearing loss? So here you have 24 adults, and they judge pictures of a young man. Typical young man is there's typically more pictures, one wearing hearing aid, and then they look at, but they are using different types of technology. They will evaluate the different types and will show them the pictures and what is in there. And they will look into attractiveness, if they're old or young, successful yes or no, hardworking or lazy, trustworthy or not, intelligent or not, friendly or not, and educated or not. That's what they will look into. So what are the pictures and what did they depict? Well, the first pictures was somebody with a BTE hearing aid behind the ear, a traditional type of hearing aid, right? But more recent style. The second one was a thin tube, an open fit hearing aid where you don't really see the ear mold anymore, and it's a fairly slim device behind the ear. The third one using a deep canal hearing aid, the CIC, completely in the canal, which is close to invisible. Only in the canal you can see something, which is also a popular style. They also looked at the traditional earbuds at that time. It's 2030, so there were still earbuds with a wire, typically used for an MP3 device. And they looked also at the Bluetooth headsets of those days. Remember, they were slightly bigger in those days, and that's what they evaluated. So what do they see? Well, if they look at the significant differences, they found a significant difference that the person using this earbud, right, listening to the MP3 player, was seen as the youngest. Interestingly, the person using the pictures of those people using a standard behind the ear hearing aid were seen as the most trustworthy. And if you just look at what is the highest ranking, so that is not a significant difference, but at least they rank higher and it's an indication. There you will see that, in fact, there are some interesting differences, and the hearing aid user, right, the typical BTE, was judged as highly intelligent, was judged as highly educated, and was judged as friendly. And that's also what we see in the conclusions. So for the significant differences, we see that the BTE wearer was seen as the most trustworthy. For the highest scores, you see that the open BTE wearer was seen as the most successful. The BTE wearer was seen as the most intelligent. The BTE compared to the Bluetooth user was seen as the most friendly. And the BTE wearer was seen as the most educated. So you see that it's kind of interesting that all these are in place, and typically the remarks and the feelings about the pictures of people with a hearing aid were much more positive than what you typically see in the people's view and all these aspects. Another study conducted later, which is looking at how children look at other children. So it's typically 45 typically developed children with normal hearing. They were aged between 6 and 11 years. They were recruited, and they asked also questions about children with and without a hearing aid. What they evaluated was, is there a difference in cognitive competence, physical competence, and peer acceptance? Also here you see on cognitive competence, they don't see a difference. So they don't see that the person using a hearing aid should be less or more intelligent. So that's the same. Unfortunately, they look at physical competence, and peer acceptance was lower for the pictures of children using hearing aids. So that is something to be aware of, but on intelligence, there was no difference. And then the most recent study was conducted in this year, only published this year. And you see also 60 participants, and they rate younger and older adults with different pictures. They were photoshopped, by the way. They looked at, are they seen older and younger? Are they seen more or less intelligent? And are they seen more or less attractive? And it's interesting to see there is no difference. So here you see Pictures of young people using hearing aids, yes or no, rated by young people. That's what you see here. Pictures of older people wearing hearing aids, yes or no, rated by young people. Pictures of young people rated by older people. Pictures of older people rated by older people. And you see, in fact, that there are no real differences. The only effect we have seen is that for the persons with hearing aids, typically they responded more faster if aspects were negative, but in the rating as such, there was no difference. So here we can conclude that are hearing aid users not respected and perceived as unintelligent? That is not true. It's a myth that is maybe floating around, but if you ask a general public, if you ask younger people, older people, you don't see that. For the young children, for children, there's an issue with acceptance. Minor issue, but that is what we need to look into. And then the last point. What about hearing loss is an invisible disability and audiologists are invisible, unknown professionals? Well, let's ask Copilot, but let's maybe look at how Copilot sees it, right? So what we do now, we ask Copilot to give us a picture of a man using a hearing aid, and you see it's a huge hearing aid. So I wouldn't call that a very discrete solution. So that's the impression of Copilot. We asked, give a picture of a baby using a hearing aid. And then you see this, which is not a real hearing aid if you ask me. Picture of a baby using a cochlear implant. That doesn't really look like a cochlear implant and it's highly visible. And give me a picture of a cochlear implant and that is something very weird. So Copilot did quite well when it came to estimations. What is the public view? What would you consider? If it's about creating images, I think that Copilot sees hearing aids too much as bulky devices. Maybe that's also how they are seen by the general public. Now, if you look at communication, is hearing loss seen as an invisible disability? Yes, it is. And it definitely is an invisible disability. And there are multiple invisible disabilities. And this has consequences because if a disability is invisible, it's not really seen, it's not really observed, and people don't take it into account. And that has multiple negative consequences. On top of that, do users prefer invisible solutions? Yes, they do. And that's why you see so much promotion activities, publicity campaigns on the best invisible hearing aids, the benefits of invisible hearing aids, pictures of invisible hearing aids. It looks like a hearing aid is something to hide. And that is why the solutions go invisible, right? Second point is the question then also that audiology is an unknown and invisible profession? And this is what you also see. Audiology, though essential, often remains unseen and unrecognized by the wider public. Audiologists work diligently behind the scenes, right? But that is not what you see. They ensure people can communicate, they can connect and enjoy the fullest of life. Their expertise is more than just fitting hearing aids. They evaluate hearing loss, they diagnose disorders, they provide personalized solutions, they do lots of stuff in different parts of the world. Unfortunately, their impact is often unnoticed because the work is subtle and also because the users don't want it to be visible. Hearing loss affects millions worldwide and it's often invisible. So people adapt, compensate and cope silently, invisibly. So audiologists navigate this what we call hidden landscape. They help individuals regain lost sounds, reconnect with loved ones, and find joy in everyday conversations. Isn't that a job you'd love to do if you see what audiologists are doing? So let's celebrate what I call the invisible warriors, the audiologists, who weave the fabric of our audible world. So let's maybe look into this and let's be more positive. This is also what we see. I think this is just what we saw this weekend. It's a ranking of job ad. It's an official instance looking at unemployment and trying to get people a job. Here you see the Flemish version. We have translated it in English for your convenience. So the ranking of scarcest professions in Flanders. And you see that head nurse is the most scarce, followed by audiologists and hearing care professionals, and then followed by other professions. So yes, we see it's an issue. And that is why we need to promote audiology. We need to create more awareness. Here you see a campaign launched by the Professional Association, the educational settings in audiology, because we want audiology to be more known. We have asked our students to create TikTok videos and to do much more to be sure that people know what audiology is. It's so important, and we really need to promote it because the number of people using hearing aids is increasing. Awareness is improving. You can see that in the Getting the Numbers Right report we are launching also this week. So to conclude, is hearing loss seen as a disability which is not important to manage? Unfortunately, that's true. The stigma related to hearing loss is not high and it's not increasing. So that's what you see from the research. So this is a myth. Unfortunately, the self-stigma of hard of hearing people is high, and that is something to worry about. Hearing aid users are not respected and perceived as unintelligent. That is false, not correct. And hearing loss is an invisible disability, and audiologists are invisible, unknown professionals. Unfortunately, that is true, and that is something to work on. Thank you for your attention, and please enjoy World Hearing Day. And now I want to give the floor to the next speaker. The handout will be available, and we also will make sure that all the references can be found of what we said. Thank you.
And now I suggest we can move to the next speaker. Next speaker is Dr. Stefan Launer. He's representing the EFHIMA, the hearing aid manufacturers, and he will handle changing the mindsets of hearing care, on hearing care. Hearing aids are more and more advanced and well designed. They don't resemble the old style big beige bananas behind the ear. They are now new modern communication solutions, ergonomically designed to fit the needs of the modern user, connecting them to the world. Stefan, you have the floor.
Good morning, ladies and gentlemen. My name is Stefan Launer, and on behalf of EFHIMA, it is my pleasure to welcome you today to talk about the changing mindset of hearing care. When we look at hearing instruments, the functionality of these devices has significantly evolved over the past 2 decades. Modern hearing instruments are offering many different solutions to help people with hearing losses cope with problems in communication and hearing in daily life. Hearing instruments come in many different shapes and forms and serve multiple purposes to really amplify the sound and provide audibility to the person, to help enrich speech understanding, speech communication and conversation situations throughout multiple different situations in daily life, and to provide a natural sound that allows for a good environmental awareness of what is going on around a hearing impaired person. Hearing instruments also are intelligent systems that can identify the sound scenes, can track what a listener wants to listen to, and can automatically select the optimal functionality in a specific listening situation. So modern hearing instruments are really agents that are intelligent and rather complex in their design. When we look at the devices, then for many years there had been a myth that a high percentage of these devices ends up in the drawer. But from the data logging data that we have available today, we know a lot about the usage time of the hearing instruments, and we know how the usage and wearing time of hearing instruments has changed over different generations of hearing instruments. So thanks to data logging in our devices, we know that modern hearing instruments are worn for a great part of the day, more than 11 hours per day, and that this average wearing time has significantly increased over the past 2 decades, that the number of devices that are not worn, so for example less than 2 hours on average per day, has significantly decreased, and that situational use has also decreased and continuous use has significantly increased. So one of the big myths about hearing instruments, that they mostly end in a drawer, is simply not true. From the millions of data logging recordings that we have available now, we know that modern hearing instruments are used, are worn, and rarely end up in a drawer, which speaks for the performance and the benefit people get from using these devices. Also, when we look at how satisfied people are with their hearing instruments, from the Eurotrack study that was also conducted by EFHIMA, we know that hearing impaired people using the devices are very satisfied and get a lot of benefit from the devices. From conversations with a single person, conversations with family members, outdoors, when talking to children, across to many different situations in daily life, when being in a car, when doing grocery shoppings. So in multiple situations of daily living, activities of daily living, hearing impaired people are satisfied today with the performance of their hearing instruments. That has also changed over the years quite significantly. So we see here how hearing instruments have impacted the quality of life of people, and how hearing instruments provide not only a person with the ability to communicate more effectively, but also give people a sense of safety, allow them to participate in group activities, change social life, change the confidence in oneself. So hearing instruments give a much broader benefit to quality of life than just enabling a person to follow conversations again. That speaks for the importance and relevance of hearing as a sense, which often is a little bit neglected and not considered important enough. Hearing is basically our social glue, and hearing connects us to people and allows us to socially participate and have a socially active lifestyle. And that is a very important fact that we should consider. And hearing impaired people, when using hearing instruments, clearly perceive this benefit of hearing instruments. So when we look at the benefit of hearing care, of hearing aids, then we see that hearing aids restore or rehabilitate the basic sense of hearing and provide audibility. In doing so, they also allow people to join communications in daily life. They provide speech intelligibility to hearing impaired people again. However, these two basic factors of hearing have a much broader impact, as I said, on quality of life. When people are able to follow a conversation again, typically that reduces the effort, it reduces the fatigue people experience in communication situations. And it takes quite a bit of anxiety away that keeps people from joining social lifestyles. Next, when using hearing instruments in conversation situations, it reduces the cognitive load. So it allows them to really attend more to the content, to focus. It allows to memorize things much more. And it has a positive impact on cognitive health, which I will discuss soon on the next slides. Finally, hearing instruments allow to socially integrate, to socially participate, to lead an active social lifestyle. And we even have evidence showing that hearing instruments increase physical activity of hearing impaired people again when starting using the devices. So overall, hearing instruments foster a healthy living and a healthy lifestyle in an elderly population. So broadly speaking, we have to change our mindset about hearing care, and we have to expand our mindset. Healthy hearing has a much broader impact on healthy living than has been considered in the past. Healthy hearing has a very positive impact on social emotional health, on physical health, and also on cognitive health. It increases or reduces the listening effort, reduces fatigue, it reduces social withdrawal and social isolation, it improves physical activity and improves activities of daily living, and as I already mentioned before, it potentially reduces the risk of cognitive decline. And that's a topic I will discuss in the next slide. There has been a lot of evidence discussing and talking about the importance of hearing loss on dementia, the impact of hearing loss on dementia, and the potential impact of hearing care, hearing rehabilitation on reducing the risk of cognitive decline and dementia in particular. There has been a lot of studies that have shown positive evidence, but most of these studies were retrospective and cross-sectional and not a controlled, randomized controlled trial. So one could criticize the study design and with that the reliability of the results. However, last September in The Lancet, a study was published of the so-called ACHIEVE trial, which was a trial including nearly 1,000 study participants in 2 arms, or actually 3 arms, and based on the evidence of this ACHIEVE study, which was led by the Johns Hopkins University in the US in Baltimore, based on the evidence of this study, hearing loss might be a particularly important global public health target for dementia prevention efforts. In this study, in a randomized controlled trial with a large study population, it was shown that people using hearing instruments, especially in a group at risk of cognitive decline, had significantly improved cognitive health in a 3-year time window. So they performed better on cognitive tasks than a control group not receiving hearing instruments, which is a very positive and encouraging result. A similar study has been conducted in Australia with very similar results that also has been published very recently. Extending on cognitive health, we also have strong evidence that shows how hearing aids reduce daily fatigue and increase social activity, so lead to people being more active, going more out and participating more actively in social lives. Next, we also have some evidence that clearly shows that when people start using hearing instruments, they start doing more activities in daily living, and with that also be physically more active, potentially have more steps, go more to exercise classes and things like that. So overall, what we see from this research is that we have to extend the mindset, we have to change our mindset and put hearing care into a broader context. When we look at hearing aids, they have come a long way in terms of functionality, performance, and adoption. Modern hearing instruments provide significant benefit in daily life communication situations. But beyond that, we also have shown that hearing care can have a very positive impact on other considerations of health, such as socio-emotional health, cognitive health, and physical health. So they can have and foster a more active and healthy lifestyle and a more healthy living in an elderly target population. That requires us to rethink how we can embed hearing care more broadly and take a more interprofessional approach to healthy living and aging, where we can connect people looking after hearing audiologists, or we can connect them more with other healthcare professionals such as geriatricians, GPs, also neurologists, and so on and so forth, to better address the needs of an elderly target population from a more holistic perspective. Furthermore, when we think about technology and technology convergence, we see the integration of more and more health sensors in devices worn at the ear. So the question is whether sooner or later hearing instruments will include more health monitoring functionalities, and with that not only provide benefit for hearing, but also turn and morph into health agents. Thank you very much for listening, and I'm very open to questions and discussions. Thank you.
Thank you so much, Stefan, for this great overview. And now I'm very happy to introduce Dr. Emma Smith. She is the Assistive Technology Specialist for the WHO Regional Office for Europe. And I'm sure she will convince us why we need to change mindsets to ensure inclusive health systems in Europe. Emma, you have the floor.
Hello, everyone, and thank you for the opportunity to speak with you today. My name is Emma Smith, and I am here representing the Disability, Rehabilitation, and Assistive Technology team, a part of the Health Workforce and Service Delivery Unit in the Division of Country Health Policies and Systems at the WHO Regional Office for Europe. On behalf of my colleagues at WHO Euro, I would like to express my gratitude for inviting us to participate in today's event. Our role at the WHO Regional Office for Europe is to support countries in our region to meet citizens' needs and expectations about health, aligned to the 2030 Agenda for Sustainable Development and the Global Action Plan for Healthy Lives and Well-Being for All. Today, in line with the theme of this year's World Hearing Day event of changing mindsets, making ear and hearing care a reality for all, I'd like to talk about a topic which we believe is fundamental to that mission, ensuring our health systems are inclusive and serve the needs of everyone, including those who are deaf or hard of hearing. I'd like to start with an acknowledgement that access to health is a human right. It is enshrined in Article 25 of the Universal Declaration of Human Rights and affirmed once again in the UN Convention on the Rights of Persons with Disabilities. Health is also acknowledged to be critical to building a more just and sustainable world. Goal 3 of the Sustainable Development Goals, to ensure healthy lives and promote well-being for all, at all ages, reminds us that significant inequities still exist when it comes to accessing even the most basic of health services. Unfortunately, the research tells us that even within those countries where there is greater access to health services, people who are deaf or hard of hearing are not able to access those services equitably. In the WHO European region, it is estimated that 20% of people have some degree of hearing loss. That represents 1 in every 5 individuals, or over 190 million people. Of those, approximately 750,000 use sign languages to communicate in one of 31 national or international languages, and an estimated third use hearing aids. The population of people who are deaf or hard of hearing is diverse as the region itself. This diversity must be acknowledged when we are discussing access to healthcare. Despite our acknowledgement of health as a human right and the high prevalence of hearing loss, access to health care and health systems remains a challenge for people who are deaf or hard of hearing. For example, a study in Greece showed that 93% of deaf people and 77.8% of people who are hard of hearing had difficulties navigating the healthcare system. This resulted in barriers in access to health services and significant unmet needs. Some of the challenges included difficulty booking appointments and limitations in the time available from interpreters to support healthcare access. A lack of understanding of the needs of people who are deaf and hard of hearing among healthcare professionals contributes to these challenges. Furthermore, poor levels of knowledge among healthcare providers in how to communicate effectively with people who are deaf or hard of hearing results in inadequate access to healthcare information and lower levels of health literacy. Accessing health information requires the information to be presented in a way which is understandable, both in language and in style, and relies on effective communication and methods from healthcare providers and policymakers. Health information is frequently provided in spoken or written form, which may not be accessible to all who need the information. Interpretation may not always be available when it is needed for those who communicate using sign languages, and critical health information may be missed or misunderstood. Difficulty accessing health information also contributes to low levels of health literacy. Health literacy is defined as having the required knowledge and abilities to understand, evaluate, and use health information. Health literacy is inextricably linked to communication with health providers. Health providers are responsible for providing the information which contributes to someone's health literacy and understanding. However, they must also be aware of an individual's existing knowledge, understanding, and awareness in order to provide the right information in the right way. The consequences of low health literacy are clear, those with lower levels of health literacy receive less appropriate and less adequate healthcare service. They are more likely to visit emergency departments and have increased lengths of hospital stays. Low health literacy also results in increased difficulty using medical advice, lower likelihood of following treatment plans, and may result in higher rates of preventable conditions and higher mortality. A review on barriers and facilitators of health literacy among deaf individuals in 2017 found low levels of health literacy among people who are deaf and hard of hearing, resulting from poor access to health information due to communication and language barriers. These communication barriers and limited access to inclusive health information contribute to poorer health. The very real impact of challenges accessing inclusive healthcare is poorer health outcomes among the deaf and hard of hearing population. For example, a study of nearly 300 deaf people in the United Kingdom was published in 2015, which showed a greater prevalence of obesity, hypertension, and depression than was found in the hearing population. Furthermore, the study found lower levels of self-reported cardiovascular disease and lower treatment rates for cardiovascular disease than the hearing population. 3/4 of those with blood sugar at pre-diabetic levels were unaware. It is clear there is a gap in access to health which must be addressed. Addressing these challenges requires commitment to inclusive health systems. The WHO European Framework for Action to Achieve the Highest Attainable Standard of Health for Persons with Disabilities 2022 to 2030 is a roadmap to develop and deliver inclusive health systems. This requires consideration of inclusive practices at all levels, from policy to practice, to ensure all receive access equitably to healthcare services. Achieving inclusion in health systems, specifically ensuring the inclusion of people who are deaf and hard of hearing, requires us to change the way we work and the way our systems operate. We need to change mindsets across all areas of our health systems, not only at the point of healthcare delivery, but also in our policies and systems, which require careful evaluation to ensure they are inclusive and do not present barriers to access to healthcare. This also requires a substantial investment in capacity building in leadership and governance. To that end, a leadership and governance toolkit is currently being developed to support the European Framework for Action and promote inclusion in health systems at all levels. The toolkit will address issues in transparency and accountability, finance and budgeting, representation, health laws and policies, accessibility, and health workforce capacity building, with the aim to support leaders and policymakers in creating more inclusive systems as a whole. Achieving inclusion in health systems, specifically ensuring the inclusion of people who are deaf and hard of hearing, also requires substantial investment in capacity building of the health and social care workforce. This is not just critical for the primary care workforce, but extends to all those within the health system at all levels. There is a need for greater awareness and understanding of culturally relevant communication methods and choices, and of the specific communication needs of the deaf and hard of hearing community. This also requires a substantial investment in capacity building for those in leadership and governance roles. When considering leadership and governance, we can't help but think about the impact of policies on access to health systems. That our policies may be facilitators to access or may impose barriers on access. It is therefore critical that when we are developing or revising policies for health systems, that we ensure representation in the conversation which contribute to those changes. Representation cannot only be in name. Representation must be meaningful, ensuring we are including a range of perspectives from those who are directly impacted by policy changes. It is critical that people who are deaf and hard of hearing are part of those conversations. Among the other recommendations of the Framework for Action, accessibility of information is also highlighted. To truly achieve inclusive health systems, information must be accessible to all service users across all potential interfaces within the health system. This extends far beyond the interaction with a healthcare provider and includes all interactions a person may have with the health system, from the experience accessing information about the service to booking and navigating services. It includes how information is communicated throughout the process in ways which are linguistically and culturally relevant for all members of a society, including those who use sign language or assistive technologies to support communication. Importantly, this must encompass access to information and adequate communication in the context of health emergencies. Technology also has a role to play in developing and ensuring inclusive health systems. While we have a wealth of technology currently at our disposal, including video relay services and hearing assistive technologies for those who choose to use them, we will also see a role for emerging technologies that use artificial intelligence to facilitate communication in health settings. As digital and assistive technologies advance to support inclusion, it will be important that we not lose sight of whether access to these technologies is equitable. Ultimately, inclusive health systems are an essential component of universal health coverage. Without ensuring that all within our society can be served by our health systems equitably, we cannot achieve universality of coverage. Achieving universal and inclusive health systems requires sustained contribution by all of us, working together to change mindsets to ensure access to health for all. Once again, thank you for the opportunity to speak with all of you today. I look forward to fruitful conversations and debates about changing mindsets and making ear and hearing care a reality for all.
Thank you so much, Emma, for this great talk. And I will suggest, if you don't mind, that we stop the presentation and that all the keynote speakers activate their video. And we made a list of the different questions we are receiving. So let us maybe already start with the first question. It's a question coming from Sandy, and she's asking, how does the Europe and the Middle East and Central Asia react differently on stigma and mindsets? Don't we need to take that into account, and how do we see that, and how do we evaluate that in a good way? I think they are very good questions, both for Shelly and for Emma. I think you're well placed to answer that. Can we start with you, Shelly?
Sure. So thank you, Mark, and wonderful listening to all the speakers. In terms of the differences across regions, it's not just about the regions. There are many differences in the way how people perceive and take care of their ears, their hearing, how they protect it, and how they also address hearing loss or seek care. Not just, like I said, depending upon the region, but also it depends a lot on the cultural context at times and the national context. And from WHO, what we do is provide tools and resources that can raise awareness, which are giving a global viewpoint, but which can also be customized according to the need of that particular region, that particular country, that particular state or community. So we invite really everybody to do research in this field, see what is most appropriate, what steps are most suitable to address the misperceptions and stigmas that are related to wherever they are, and to then address them systematically. And you're welcome, of course, to use the WHO resources by adapting them to your context. But Emma, please jump in and give the regional context. I think that would be useful.
Thanks. And I mean, I agree with everything you've said, just in terms of the context differs regardless of the region. It can differ from country to country, but it can differ within a country. You may have different context in rural versus urban environments. You may have different context depending on level of education. So contexts vary regardless of where we are, and that means that our understanding of hearing loss, our understanding and perceptions and stigmas, they change depending on who we're speaking to. I think what it really highlights is the importance of person-centered care across everything that we do, and acknowledging the importance of what the person needs for their own well-being. But when we're looking more systematically at a policy level, that we really start from a solid understanding of what the contextual factors are and what is critical for that country, for that region, for that area, acknowledging that no two areas or no two countries will be the same, and that there may be specific limitations that need to be addressed in a particular region. And that is the beauty of things like the WHO tools, which are meant to be customized. They're developed with that in mind, with the understanding that we are going to need to change them depending on the country context. And as you were saying, that is, people are welcome to do that with those tools.
Thank you, Emma. And maybe also Lidia can shed some light on that, because I guess that European Federation of Hard of Hearing is all over Europe. Do you see that your members, Lidia, have different views on stigma, have different ways to handle hearing loss? Do you see differences in Europe among your members, how it's handled and how they react to it?
Thank you. I mean, thank you for Emma and Shelly input as well. So from someone who has hearing loss and encounter different situation in daily life, it is very interesting for me to see the differences even between Europe. Now, I'm Polish by birth, and I have lived for many years in Poland, and I still have very keen interest and often visit Poland. But I also am now residing in the United Kingdom, and I see the differences. The differences even between United Kingdom and Poland. The way how much easier people understand that I have a hearing loss, so they still assume that I know sign language, but they ask what I need. Whereas in Poland, for many, many years, I would see that the assumption is, of course, all we need is sign language and everything is resolved. So, and the way the people also communicate with me, if I point out that actually the assumption is wrong, in the UK, the response is much more empathic, much more understanding, okay, I got it wrong, how can I help? How can we find the best way forward? Whereas in Poland, I have had situations when the response was quite negative. So I can understand why members of the European Federation may have different experiences depending in which country they live. Is this to do with the way we are being brought up? Is this to do with the ignorance? Is this to do with any of our reasons? It's very difficult to tell, but I think we have still quite a lot of work to do. And when it comes to countries from outside of Europe, I think from my interactions with colleagues from outside of Europe, the situation can be really difficult to try even to raise the voice and say, I am hard of hearing, I need something else. It's very difficult for them to get their voices heard. Thank you.
Thank you, Lidia. And I still remember that we had the World Hearing Forum in November in Geneva. And you suggested to make a picture of all the people using hearing aids and hearing technology and stand on the stairs. And I was surprised when I saw that picture, because of many of those people, I didn't know at all that they were using hearing aids. And I'm an audiologist on top of that. But I think what was remarkable, how dynamic all those people were, how outspoken they are. And I think that to change misperceptions, it's a very good idea to show hard of hearing people using their efforts, showing how strong they are. And as you rightfully say, you're not an audiogram. You're not a disability. You're a person with possibilities, potentials, and using that to the fullest. And that's exactly what we need to use. So I think the proof of the pudding is in the eating, as they said. Well, let's show people back this. My other concern is that if you talk about stigma, it's a little like depression. It doesn't help to say, well, the sun is shining and you have a lot of money on your bank account, and then depression is gone. I'm afraid it's comparable to stigma. You need to see examples, you need to experience it to make it possible and to make this stand. Now, the next question is more directed to Stefan. I think it's coming from Margarita. She's saying that, hello, thanks a lot for the presentation. I would be curious to know from panelists, what are your thoughts about the increasing hearing aid features in daily use devices? Also, do you see emerging technologies that could perform similar functions to traditional hearing aids, especially considering the inconsistent and often inadequate reimbursement policies in European countries? And I'm happy I can pass that monkey on your shoulders, Stefan, please.
Hi, Mark. Thank you for the question, and thank you all for taking the time to listen and attend to this, from my end, very important topic. It's a pleasure to be on this panel. So from my end, when I look at hearing instrument technologies and how they have developed, it's really remarkable to see that we now have devices at different performance levels with very specific features and functions. We have basic technologies that really offer, are of great help for people in need. And then we have technologies with very specific features and solutions that help individual people with more complex listening needs, complex listening situations, also showing good benefits on these specific features. In terms of complexity, all the hearing instruments that we see today in the market have some form of an automatic functionality. So they identify situations automatically and then switch and select the optimal signal processing strategy automatically. So from the feature perspective, the complexity in terms of handling is absolutely manageable because it's managed automatically. But we can offer manual handling, manual interaction to people who want and are capable in handling that through an app. Now the question was, what about replacing technologies or other emerging technologies that we see? I think first and foremost, we have to understand that yes, there are a lot of emerging technologies, but we still have to understand that hearing instruments and earbuds, hearables that we see on the market today have different requirements in terms of technology and development and user needs. Hearing instruments of today are worn for 12 hours per day, 7 days per week, which is a very different requirement in terms of power consumption, wearing comfort, and reliability that these devices have. Also, if devices are reimbursed, they are reimbursed every 5 to 6 years. So that's the lifetime of a hearing instrument. And surviving such a time span with such a usage frequency at the ear is a complex technical undertaking. And so we have a couple of technical user need differences between emerging earbud technologies and hearing instruments that still are out there. Still, I think we can all benefit from these emerging technologies if we think about devices that maybe don't serve people with a complex, moderate to severe hearing loss, but if we think about people with mild hearing loss, maybe not even in hearing loss in audiometric terms, but a self-perceived listening difficulty, who might need situational amplification devices. And I think that's where we can benefit from these emerging technologies and also new solutions of helping these people. I think at the end of the day, from my end, what is most important is that we don't think about different categories, but that we think about a continuum and also a continuum of care. and how can we also help people from one segment to another segment. So I think that's a very, very important aspect for me. And regarding the reimbursement landscape, when I think of hearing loss and how it impacts quality of life and how it is a silent but very difficult or very heavy kind of problem and challenge for the person, I think it would be important to have a harmonized reimbursement across the entire European Union and at least reimburse the basic level technologies for everyone. When we think about the cost of the device, it's not only the device, but it's also a lot in the service and the service delivery. It's very important to have healthcare professionals help people at some point with being motivated, selecting the right technology, fitting it, and then also motivating in using it. So we should not only discuss reimbursement related to product, but we should always consider the very, very important aspect of service delivery and the work of the healthcare experts, the audiologists, or hearing aid acousticians and dispensers. Any additional comment, Mark, or any follow-up question? I hope that answered.
Well, I'd like to comment from the hearing care professional side of things. To be fair, I think that we should never be scared of new technology coming in. And the more technology that can help people to better communicate, the better we like it. I don't think we should be scared about it. The other aspect is that, of course, we need to ensure it's safe. So we're very happy that hearables have now transparency modes and can give some amplification. And most of those good quality A-brand hearables are also quite safe. So they take that into account, no problem at all. The other aspect is, and as you rightfully say, don't focus on the product, because focus on the use and focus on the service. You may have seen today there was a LinkedIn post of a new article in the International Journal of Audiology stating that audiologists in the UK don't get the time and the proper training to be able to provide person-centered care. And that's a drama, because it's not about having the solution. It needs to be provided so it's part of people's life. They are fully empowered. And that is what changing mindsets is all about. It's not about hanging a hearing aid on people's ears. It's about making use, it's part for them. It's doing what it needs to do for them. And it's making it possible to explore all the possibilities and to live their life for the fullest. And I think that's essential. And we shouldn't complain too much, because in Europe, the refunding is fairly okay compared to the rest of the world. But I'm very happy that EFHOH makes this frequent report on reimbursement in Europe, Lidia, and that we can convince our policymakers that they need to be sure that everybody who can benefit from hearing care technology, including services, should have access to that. And I think that's what you've been working on right now. Now, before giving you the floor, Lidia, there was also a question on the picture you have shown on that person having this huge shrimp on the ear, stating that hearing aids are horrible and what they have is invisible. Now, they are asking what kind of promotion or publicity that was, if that was something you found in the UK, and if you protested against publicity like this, because it seems quite gross. And maybe after that, you can also highlight part of your reimbursement report from EFHOH, if you don't mind.
Thank you, Mark. So, to be honest, it's been quite a few years ago when when we saw this advert, and I think it was in the UK. This kind of ugly kind of advert saying, "Oh, how wonderful our hearing aids because they are, invisible," and there was a lot of backlash, especially from the community of deaf and hard of hearing people saying, "Come on, you're making things worse, and you're making people who are about to look for the solutions to the situations they are in to be very conscious of the fact that hearing aids are a bad thing because you will be seen in a very bad ways. And that was a really wrong thing to do. And I use it all the time as kind of a warning that this is the worst possible way to advertise your product. your product should be much more inclusive and much more in positive ways. For us, for example, from European Federation, when we look at the personal sound amplifiers, we understand that some people may want to go for them and that as the first solutions, but they soon may realize that this is not entirely solution for the situation they are in. And personal sound amplifiers, first of all, need to be safe. And they weren't safe often when we saw them years ago, before we did the report to the World Health Organization and the International Telecommunication Union, but actually they were very unsafe, and our members were protesting in their countries, respective countries, to shops which were selling them, saying, hold on a second, this is really unsafe product. So it is important that we understand, yes, don't focus on the product alone, but actually on the service. An audiologist will be the first person someone with hearing loss may meet, who will be able to guide them as well, reassure them on the ways how they can adapt and what there is a life after hearing loss, let's say. And that is very important. For this reason, we are very keen to see increased reimbursement levels in Europe, in the countries which have very poor levels. When children are supported, it is very much important part of their lives, and it's great that they are supported very well. What we're not seeing is the adults or even older people in the retirement age receiving the same or at least similar reimbursement as the children. And it's not about putting one group against another group. No, it's about making sure that the support is across the lifespan and making sure that everyone can get access to what they need. I do not want to see on social media some hard of hearing adults basically crowdfunding money and support just to be able to buy the hearing aid they need. This is not Europe. This should not be happening. And we need to make sure that everyone who needs the access receives it. Everyone who needs the service of a professional receives it. So that's basically essence of our work and our advocacy. Thank you, Mark.
Thank you so much, Lidia. And then there's another question. I think it's kind of controversial. So it's Patrick Henning saying that a large bank is providing good quality mobile phones to their people so they can communicate better. Positive news. And then he adds, is it so that if more people with hearing impairment could be helped technically, the less sign language would be needed? That's his suggestion. Now, before we go into that debate, let us be clear. I think we're inclusive for all. So if people want to use sign language, and that's the main way of communication, it's not up to us. They say they can or they can't do that. It's a language, it's a way of communication. Is it so that if more people can use cochlear implants and hearing care technology, that there will be maybe less need for sign language and other support? It's something to be aware of. And I think Lidia is also an expert, and Shelly on that as well, because some people think that if you have a sign language interpreter, it's okay for everybody with hearing loss and it's okay for everybody using hearing aids. And let me tell you a secret, the vast majority of people with hearing aids and hearing loss don't understand sign language and can't use it. Now, for the deaf community and for those people using it actively, it's a wonderful way of communication. So it's not a choice between one or the other. And I think we need to be inclusive and respectful for all to be sure that we are inclusive for everybody. Would you agree on that, Lidia? And maybe also Shelly, can you add something to that?
Do you want me to go first?
Sure, why not?
No problem at all. No, I actually disagree on anybody saying that, okay, if we give a technical solution, then we resolve all the problems. In my presentation, maybe not everybody saw me when I was presenting, but I basically used this. We are not fixed. So it doesn't matter if you are receiving hearing aid or cochlear implant. Everybody has different background and starting point when it comes to hearing loss. Those who are born with hearing loss from early age, who are born deaf, will require and will benefit most likely from sign, because that's the only access they can get to language. Whereas someone who is like me, when I've lost part of my hearing at the age of 12, it's a completely different story. I want the access to the spoken language, but hearing aid, or right now, what I'm using is cochlear implant, is not 100% resolving all the situations where I am in, and that's when I need additional support, such as captioning or assistive listening devices. So thinking that we provide someone with hearing aids or cochlear implants, we do not need anymore to provide any reasonable accommodation is absolutely false. Everybody's different, and we need to make sure that we ask first, what do you need? And if someone asks for sign language, we should be provided it. If someone is asking for assistive devices or for captioning, we should be providing. They shouldn't be us and them. There shouldn't be a situation like that. Thank you.
Now, maybe before giving the floor to Shelly, because I want you to answer that as well, Shelly, because I know you have very strong opinions on that. I think I want to make use of you as a star also to conclude, to make some conclusions of this debate. Because I think we will stop after you have done that. I want to thank all the key note speakers and all the audience for the interaction. But please, Shelly, can you go and discuss this level of sign language? And if you wouldn't mind, could you also conclude this session? Thank you so much.
Sure. So I think we have conceptualized and put out WHO's position very clearly in the World Report on Hearing, which was published in 2021, which focuses on integrated, people-centered ear and hearing care. And this is really a holistic term. It's wide-based because it encompasses all aspects of ear and hearing care, starting from prevention, from identification, from providing treatment for those who need treatment for their ear problems, and also rehabilitation and support services. So it's really a comprehensive definition. And of course, the World Report on Hearing also puts forth strategies or a hearing package of interventions on how this can be provided. And in all of the aspects of hearing rehabilitation, there are, well, various means available, including hearing technology, use of hearing technology, rehabilitative therapy, as well as use of sign language, lip reading, and other alternate modes of communication, as well as captioning, provision also of assistive devices such as loop systems, etc. So I think it's important that we always consider this in the wider context, in the bigger context, always looking at what people need. And it's also important not to deprive in our efforts to kind of make certain strategies based on a resource or a particular strategy, not to negate the other one. Hearing aids, as Lidia pointed out, cannot fulfill, or cochlear implants cannot always fulfill the needs of those who require or prefer sign language. And likewise, a sign language access or interpretation cannot fulfill the needs of those who don't use sign language. So that is, of course, really integral to WHO's work, WHO's overall thinking about ear and hearing care, that both of these are essential. We know also of examples where children in deaf schools have been provided hearing aids, and the next day sign language interpretation stopped for them because they now had hearing aids. So those are exactly the kind of things we don't want to happen. Nor is the other way correct as well, that if you provide sign language interpretation, then all the needs for hearing care are somehow fulfilled, because every person is an individual, and we need to have that focus on people-centered strategies and person-centered care. So that is WHO's focus. It's not always easy, and countries often need to prioritize where they want to start from. What is the starting point based on the needs, on the priorities of the country, and also looking at the resources available in the country. And that is fine as long as there is a systematic stepwise process to make sure that we ultimately have the right principles and we have the right goal in making ear and hearing care for all accessible. So I'll stop there, Mark, and also invite my colleague Emma to add anything if she would want to at this stage.
Thank you, Shelly. It's been a pleasure to be here and agree with everything that you have mentioned, but just from a WHO Euro perspective as well, if anybody is here and would like to reach out to us in terms of the supports that we are able to provide at the country level, I'm more than happy to speak about those as well if you reach out to our team. So thank you again for the opportunity today.
You have some final words, Stefan?
From my end, I think this was a great session, very important session, and it's extremely important to bring hearing care to the forefront of everybody's attention because, as I said earlier, I think it's kind of a silent curse. People are not aware that it's taking place, and people are not aware of how much it impacts health, healthy living, and what the societal impact is. So from my end, this is, I think, where we have to change the mindset and open up and think about innovative and improved ways how we can help people and how we can change the perception and the relevance people give to hearing care.
Thank you, Stefan. Do you have some concluding remarks, Lidia, before we close the session?
Thank you for organizing it.
You're very welcome. Thank you for the good cooperation. Lidia, did you want to add some last words?
I'm actually about to take a photo of all of us. One more print screen.
Okay. So when we have the photographer Lidia working on that, that's perfectly fine. I would like to thank everybody, the joint associations, WHO, Europe, and Shelly for the time. Also the interpreter for making everything happening, and the speech to text in the different languages. And really all the interaction. I see many questions, many more than we have seen. We will try to provide you some of the answers we have seen before. Thank you all for joining us. Celebrate World Hearing Day, and you don't need to stop at the 3rd of March. You can continue for the rest of the year. Hearing is so important and hearing care is essential. Thank you all the best. See you. Bye.
Thank you. Bye-bye.